Hey guys, welcome back to my channel. I have a little bit of a different setup here. I've fixed the lighting and hopefully it will look fine. Today I am doing another info video. This one is my hysterectomy series. So this video is going to be about finding a surgeon and then what your options are for the type of surgeries. Because if you don't know, there's multiple options on how to get a hysterectomy. So first, a couple options to find a surgeon. The first one is if you have a clinic or a transgender organization, they most likely will have recommendations for a histo surgeon. If not, you can try Googling trans-friendly gyno surgeons, and hopefully you'll get a list like that. Ideally, you like to go to a surgeon that has worked with trans people before. That way they know what's going on, as it can be confusing to some surgeons. Especially if you've had your name changed, your gender marker changed, and you pass as a cis male, it can be confusing. So first, you want to do your research on the different procedures. There's less invasive procedures, and then there's very invasive procedures. So I'll go through those briefly. Less invasive that you can get, and that is the vaginal only hysterectomy. So this one is good if you just want your uterus and your cervix out for like prep for phalloplasty, or just for your personal preference, because they're unlikely to get your fallopian tubes in your ovaries during this procedure. So yeah, just kind of keep that in mind and make sure you ask about that one. The next one is the laparoscopic. That's the most common because they can get everything. So with that one, they make a couple incisions, like very small incisions in your abdomen. They use a robot to go in there and take everything out. And then in rare cases, some people have to get a full open abdominal surgery. So this is where it's kind of similar to a C-section, where they make an abdominal incision and actually open up, and that is the most riskier surgery, the most complicated, the most recovery time. If you can try to avoid that one, that would be great. So it's very important to know your options. Keeping your ovaries is up to you and your goals in life, like having biological kids, so keep that in mind. Only you can decide on this. You can also have your eggs retrieved and then frozen if you'd like to have kids but want your ovaries taken out with this procedure, so just keep that in mind.